Because we got to start, yeah. Well, after this song, after this. Okay, you want to be a part of this? Any time for Q&A, just bring it up to me.
Okay, everybody. You can hear my voice once? You can hear my voice twice? You can hear my voice 3 times. All right, so I welcome all of you. Thank you so much for coming out today. Thank you for bringing your families. The next part is all informational. And so we want you all to listen to the folks that are live, get the information that you need about the COVID vaccination, and spread it to everybody that's around you so that they can feel more informed and they can feel more connected when it comes to the healthcare system. We all know that there's so many disparities that exist within the Black community, and it only takes 16 people, 16 to spread it across the community, and we have so many more than that today. And so when we get young people informed, and we also get their elders informed, we're gonna do what we need to do for the Black community here in Green Bay. And so I'm happy to be here with you all live. I'm happy to be given an opportunity where we can, as a Black community, be informed. I want you all to listen up and ask the questions that you need to ask in order to be informed about the COVID vaccination. So we want everybody to pay close attention and to be focused. After this, we're gonna give away our Easter baskets and have an opportunity for you guys to go home and be with your families. But thank you so much for coming out to this event. And thank you so much for listening to the medical doctors that are here to give you the information that will make us feel more comfortable as we move forward and get our community vaccinated or more informed about how to take care of our health in our community. Thank you so much.
Good afternoon, good afternoon, good afternoon, Northeast Wisconsin. Good afternoon, Keith L. Brown, Mr. I'm Possible here. It's not impossible, it's I'm possible. Happy Resurrection Sunday, happy Easter. It's time to rise up. I want to thank everybody for being out here today. I want to give you all a GOODJOB. Good job, good job. I said GOODJOB. Good job, good job. Hey, I need y'all to understand today, it's all about get the shot. It's all about live, L-I-V-E. It's that Easter brunch. It is our virtual training right here on Easter. Listen, we're going to rise up Northeast Wisconsin, and LIVE stands for life-saving information, vaccination, education, life-saving information, vaccination, education, life-saving information, vaccination, education. So on the count of three, I'm going to need all of y'all to say that with me. Once again, it goes like this: life-saving information, vaccination, education. Everybody, 1, 2, 3, say it with me. Life-saving information, vaccination, education. Life-saving information, vaccination, education. Give yourselves a hand, all of you fabulous families, all the children and the young people. I saw y'all jamming under the tents. It is a great day. The sun is shining. We are breathing. We are alive. And we're going to get so much information today on COVID-19 and the vaccine. COVID-19 and the vaccine. I want to give a special shout out to the African Heritage Inc. African Heritage Inc. Also, We All Rise, and all of our sponsors. Thank you so much to the Greater Green Bay Foundation. Greater Green Bay Foundation, thank you so very much. One Structure is in the house. And of course, on the wheels of steel, the legendary DJ Hayes. On the wheels of steel. So I need y'all to sit up right now. Young people, I need you to sit up. Children, I need you to sit up. Families, I need you to sit up. Get right, get tight. It's all about education. You just had a lot of fun. You just had a lot of music. And now it's about educating our minds about that life-saving information, vaccination, education. At this time, I want to present to some and introduce to others the two visionaries behind Get the Shot, two women of purpose, two women of excellence, African Heritage Inc.'s own Dr. Bountiful, Bold, Bola, Dutiful Delano, and Dr. Significant, Sensational, Sabrina, Respected Robbins. Put your hands together as they come to the platform. Put your hands together, everybody. Yes.
Greetings, greetings, greetings. Good afternoon to everyone there. Good afternoon, good afternoon. Thank you all for coming today. Shout out to my sisters, my family out there at We All Rise. Thank you, thank you, thank you. Today is indeed a great collaboration and a partnership. It takes a village, and we're all the village. I am Dr. Delano. I am one of the co-founders of African Heritage Incorporated. And I need to tell you all that African Heritage is an organization unapologetically centered on we Black folks. It's all about we Black folks, and that's what we do. 365 days a year, that's what we do beyond February, and that's what we do with you and for you. So we are your organization in Northeast Wisconsin. And again, thank you to We All Rise. You know, today, April 4th, is a significant day. Today, African Heritage is launching a campaign. And some folks may say, why are you doing it this Sunday? Why? Well, we decided to pick April 4th because April 4th, 1968, in Memphis, Tennessee, 1968, in Memphis, Tennessee, Dr. Martin Luther King was assassinated. So for those who ask why today, it's important for us to launch a campaign today, a campaign that continues to destroy our communities on one hand, okay? A campaign, not a campaign that is destroying our communities, but COVID-19 is destroying our communities. That is why we're launching this campaign today, to crush COVID-19. And we're gonna say, bye Rona. That's what we are going to do. But in addition to that, when I think about Dr. Martin Luther King, Dr. Martin Luther King said, injustice anywhere is a threat to justice everywhere. And you all know what? On this day, we remember Dr. King because we also know that the racial inequities of Black families disproportionately losing their lives to COVID-19 is an injustice. And we are about to put an end to it with your help. So today, in remembering Dr. King and the work he's done, and he continues to do based on the legacy that we continue to do the work he has started for us, we launched the Get the Shot, Leave campaign. Get the Shot, Leave campaign. And African Heritage is here to say, get the shot, leave. You may ask, what is leave? L for life-saving, I for information, V for vaccination, and E for education. So we're asking you to please join us in this campaign. Dr. Robbins.
Good afternoon, everyone. Thank you so much for coming out. We know it's Easter, so we know that your meal is wonderful. We've had a similar meal here. We're here in Appleton, and we wish we were with you today. But if we all get vaccinated, then we all will be have the chance to be together. And I just want to I can't tell you how important you are and how important it is for us to live so that we can continue to get the best of what life has to offer, not only for us, but for our children. I want to thank We All Rise for collaborating with us and our sponsors, the Green Bay, Greater Green Bay Foundation, all with a solid commitment for Green Bay in the outer area so that we all can live and help build back America better. So thank you. I won't hold you up because we have a great doctors for you all. So thank you again.
Thank you so very much, Dr. Dutiful Delano and Dr. Respected Robbins. Thank you so very much. Thank you so very much. GOODJOB. Good job, good job. And listen, children and young people, you have to spread the word about Get the Shot. You can spread the word whether you're in school in a hybrid model, whether you're virtual, whether you're in person. You got to let them know African Heritage Inc. wants us as a people to live. And that's life-saving information, vaccination, education. And we have some phenomenal Black medical professionals here, some doctors who are just internationally known, nationally recognized, locally accepted. You are hearing information today from the experts. Don't listen to the conspiracy theories out there. Don't listen to the opinions of others who have no idea what they're talking about as it relates to COVID-19 and the vaccine. African Heritage Inc. and We All Rise, we are bringing the best of the best today. So if you want to take advice from someone, take advice from the experts. And we have experts here today, like Dr. Respected, Resourceful Richard Amankwah. He is originally from Ghana in West Africa. He attended college at Lawrence University in Appleton, Wisconsin, earned a degree in chemistry, received his medical degree from Albany Medical College in Albany, New York, and both his internship and residency at the Medical College of Wisconsin, Milwaukee. Listen, he is board certified. Y'all know what board certified means? It means he is certified, he is classified, quantified, edified, and qualified. That's who you need to listen to today. He is a fellow of the American College of Physicians, and he works in your community in Green Bay. Yes, he is making a difference. He's making it happen, and he is on our panel today. Next up, we have Dr. Awesome Advocating Abiola Keller. Yes, assistant professor at College of Nursing at the Marquette University, where she teaches undergraduate courses focused on the social determinants of health and graduate courses in epidemiology. Her research, oh man, listen, she is brilliant. She is brilliant. Shout out to Women's History Month has been extended today. It has been extended. Listen, she is an expert in improving health outcomes for Black women. She has the commitment to Black women. She has a commitment to minimizing health disparities in the Black community. Currently, she co-leads a federally funded project that supports employees and employers in the near west side of Milwaukee. Once again, she received her PhD in population health sciences, Master of Public Health degrees from the University of Wisconsin-Madison. Once again, that's Dr. Awesome Advocating Abiola Keller is in the building. And then we have Dr. Bold, brilliant Brian Temple is in the house, and he's already put in a full day of work. So we are so honored to have him here today. He is an infectious disease physician and advocate at the Aurora Hospital in Oshkosh, Wisconsin. He serves as the chair of infection prevention and antibiotic stewardship, the vice chief of staff for the medical center. Listen, he received his bachelor's and master's degrees from FDU in 2000 and 2001. He has worked at the University of Mississippi, down there, Oxford, Mississippi. And listen, he is here today. I want y'all to show your love for Dr. Bold, brilliant Brian Temple. We have three of the best in the medical profession. GOODJOB. Good job, good job. I need you all to sit up. I need you to sit up, sit back, relax, open your minds, open your ears, and listen, because I promise you, this life-saving information, vaccination, education can save your life. And yes, I have gotten both shots. All right, I want all of our panel members, go ahead, all of our panel members. We have, once again, we have an awesome panel. We have the tremendous trio here today, a tremendous trio that's gonna drop a lot of knowledge on us today. And leading Laura is going to go ahead and begin with our Q&A, And before the Q&A, I'm going to give each one of our panelists in the order in which you were introduced. I want to give each of you just 1 minute to go ahead and empower all of these purposeful participants, all of these fabulous families, these committed children, and these yearning young people today. Please do that. Panelists, thank you so much.
Thank you very much, Mr. Impossible. My name is Dr. Amankwah. I'm an internal medicine physician, so I take care of adults from 18 and above. And I'm currently working as a hospitalist at St. Vincent's in Green Bay. Thank you for putting together this program. I think that COVID-19 has been deadly for the past year. And I think to have a remedy with the COVID vaccine is really an important step. So I'm glad that we are here to educate ourselves and to see the importance of getting this shot. Thank you.
Good afternoon, everyone. Happy to see you. Happy Easter. Happy Resurrection Sunday. So as Dr. Delano pointed out, the effects of COVID-19 have not been felt across the board the same by different communities. Our communities of color have suffered unnecessarily because of just the history that this country has perpetrated on communities of color. But this is our opportunity to start to fight back. This vaccine is available. It's currently available to all Wisconsin residents over the age of 16. And it is up to us to step forward and say, I will take the vaccine because I want to live and I want to do the things that my family deserves. I want the life that was guaranteed per se in the Constitution, and this is part of that fight. So it's upon us to become educated about what it means. And by education, it means not necessarily what is on the different TV stations, but talking within our communities with people that we trust to know what does this vaccine mean for us as individuals and our family, but what does it mean for our community in terms of improving our health and well-being, and continuing to strive to be the best that we all can be.
Hi, I'm Dr. Temple. I just want to say thank you very much, African Heritage, for putting this event together, for having us here. It's my honor and privilege to join this esteemed group of physicians and educators and scientists. I know Dr. Amankwah, we've worked together seeing COVID patients and non-COVID patients. All I want to tell people is COVID is real. For those who don't think it is, it's real. One thing I want to tell you, another thing I want to say is the vaccine is real. The vaccine works. We need to protect ourselves. We need to deal with truth. We need to deal with real science. We need to understand that if we don't protect ourselves, vaccinate ourselves, would create another health disparity in the African-American community, the Black community. We don't need another one. We already have many things we need to deal with. Our job here is to answer some questions, ask us questions, intelligent questions. If they're not intelligent, we'll try our best anyway. But honestly, we just want to let you all know that we're here to do what we can. We're out there trying to make sure people get the right information. I've received my vaccines and I'm still here. My wife has, my mother has, she has her second one coming up. So let's all get out there and vaccinate.
Thank you so very much to our tremendous trio, three of the best in the medical profession, GOODJOB. Good job, good job. And the first question is this. Nationwide, we've heard a lot about herd immunity. And if you would, please explain what herd immunity is and the role that Black people will play in herd immunity as it relates to COVID-19.
Do we want the epidemiologist to deal with this one? And then we can all jump on it.
I'm happy to start. Thank you. So the idea behind herd immunity is really that, when you have diseases like a virus that COVID-19 is, it needs to find humans or people to live in. If we can't find people to make sick, then it essentially goes away. So the thought behind this is if we can get enough people vaccinated so their body can fight off that vaccine, then it can't continue to make people sick, and eventually it will at least go away or be at a level that we can actually control and manage. So the call is that we need people to get vaccinated. Science has done its job. We, as the scientists, have created a vaccine that works, it's safe, and we have ways to get it to people. Now we need people to take the vaccine, and the more people that we have who take the vaccine, the quicker we can get to the point where this virus can't continue to jump from person to person and make people sick. So, all of our communities, we are all responsible, to take our, role and get vaccinated. I got vaccinated for me. I got vaccinated for my parents. I got vaccinated for my children, for my community. And that, I think that's the call, is that to take care of ourselves and each other, we need to get vaccinated.
I just want to add one thing to that also. We also need to understand that people who cannot get vaccinated, so the immune system does not allow them to. So the goal of herd immunity is to allow the population to protect those that cannot get protected. So we are doing for ourselves and for others. We have to hit a certain amount of numbers for that affects so that you cannot transmit disease around to those that are not or cannot get vaccinated. So again, we need to get vaccinated before. We can't wait and say, well, let the disease itself spread, because then you're saying that you're accepting a high degree of mortality, which is not something that we can accept. We've already lost greater than 500,000 people, and those are 500,000 individuals. We have something that can prevent that from happening. Let us all do our jobs and get vaccinated.
And to add to Dr. Temple and Dr. Keller, I believe that unless a majority of the population are vaccinated, what we are all doing will be totally ineffective. So the vaccine by itself is not going to work unless it gets into our arms. So I'm strongly going to encourage that if it's available to you, please do your due responsibility and get a shot. If we want to get back to any form of normalcy like we did before, we need to have majority of us all getting vaccinated.
Thank you so very much, Purposeful Panel. Thank you for that insight and that relevant information. At this time, I want to turn it over to a young woman of excellence and vision. African Heritage Inc.'s own Leading Laura Jones has a question from our amazing audience. Leading Laura, you're up.
Can you hear us?
Yes.
Give us a thumbs up if you can hear us. Yes, you can hear us now?
Yes.
Okay, go ahead with your question.
Thank you, panel, first of all, for being here. Is pertaining to the variants of COVID, and is the shot going to prevent us getting reinfected, or is there going to be another shot that we'll have to take?
That's it.
So I guess I can just kind of touch on that. So it's somewhat of a three-part question.
Hold on. Simple. Hold on. Dr. Temple, hold on.
All right, so I'll just try to address some of those questions. One, right now the vaccine that we have works, and that's great. In regards to some of the variants, there are studies out there showing that a lot of these variants, the vaccines are effective. I'm saying vaccines because more than one is effective against various variants. As far as reinfection, very, very, very rare cases of reinfection occurring. Very low likelihood of infection occurring when someone is vaccinated. And again, everything is not 100%, but what we do know that even if someone gets exposed or does carry, that they do not proceed to end up in the hospital, which is something, and that's the goal, is trying to decrease mortality. So all the vaccines across, regardless of efficacy of how well they protect us again, the COVID disease, what we know is that close to 99 to 100% of them kept people from going into the hospital and dying from the disease.
Can I add one more? I also think if we actually also want to prevent more variants from happening, I guess in infectious disease, viruses only mutate when they replicate. So to prevent them from growing or replicating to cause more variants, we should get vaccinated. That will be a way to prevent these variants from happening. But from what I've read so far, I think most of the vaccines we have available are at least effective against critical illness from COVID-19.
I think what I will add, and just to echo what Dr. Temple pointed out, is, the reason, at least one of the reasons that COVID-19 has been, such a concern is one, that it's really easy to transmit, but also people get really, really sick when they become infected with COVID-19 in terms of the number of people that have had to go to the hospital and the number of people that have died. And so with these vaccines, what the promise of them is that, even if once you've been vaccinated, if you were to become exposed, the chances that you would need to go to the hospital and be on a ventilator and maybe die becomes decreased dramatically. And that's what we're hoping for, is that if we can get people to the point where we're not overrunning our hospitals, we can beat this thing. But if we are constantly trying to play catch up in terms of the number of people that are really, really sick, we don't stand a chance. And we get to the point where, you know, we look across the Atlantic Ocean to our, you know, what was happening in Italy last summer, where, you know, our hospitals were having to make decisions about who gets the hospital equipment that they need in order to fight this disease. We don't want that here, and we don't want that in our communities. So right now, we have a chance to make sure that does not happen here. And that means that we have to go to wherever the place that you can get vaccinated is and get the vaccine that is available to you.
Yeah. And I'm going to add one last thing just to kind of round that up. What happened in Italy did happen in the US, also in Texas, so it's not that far away. And also we have to remember that some people are like, well, I'm young, I don't have to worry about that. Yes, you getting vaccinated prevents your grandmother or your best friend's grandmother or that old lady you hate from dying. So those are the things we have to think about, is that by getting vaccinated, you're decreasing disease transmission. Hence, like Dr. Amankwah said, you're decreasing the probability of someone else catching this virus and then mutating into a more resistant variant.
Thank you so very much once again to our purposeful panel. This is some information that is so valuable, that is so valid. We definitely want you all to leave today and to share this information. Share this information on your social media pages. Share this information with your family members and your neighbors, because for so long in America, Black folk have had to bear the brunt of the negative. And so it's about time that we got the benefits of the positive. And one of the benefits of the positive is the vaccine. So definitely get the vaccine. We're going to go back to our on the ground correspondent. Miss Leading Laura Jones has another question from our amazing audience. Back to you, Leading Laura.
Go ahead and ask your question. Sorry.
Hello, my name is Reggie. One of the questions I have is all these different statistics about people who get infected, and how well that they don't.
Hold on 1 second. I'm gonna get you the mic.
Okay.
Hold on 1 second. We're gonna get the mic so everybody can hear.
Hello. Once again, my name is Reggie. I got a question about the statistics that we hear about people that get COVID and, you know, return back to normal. Like, getting a vaccine is not a guarantee that we're not going to get COVID. And where can we go to find the statistics to help us make a determination if we feel like we should take the vaccine? Thank you.
Hold on. Shut on up. Yeah.
All right. I guess I can jump on this quick. I'm trying to understand. I think he's asking where can the best place for him to get information to support vaccine use. I'll say one, go to the CDC website. That's a great place. Go to the local health department website. That's a great place. I'll tell you from all my colleagues, everybody that I know, all my family members that have taken the vaccine, yes, it is good. It's a I guess I'm trying to, yeah, it's 99% probability from, 95% that you're not going to get the disease, but it's close to 100% likelihood that you will not be sick and end up in the hospital. So that's kind of my, I guess, understanding of the question he's asking. I'll hand it over to the rest of the guys.
Yes, I think that if I heard him right, the way to get the information is to go to the CDC website, but also from talking to physicians and scientists who've reviewed the information themselves. And as you said, from the trials, nobody who was vaccinated died. Okay, so that's the first thing. I think that secondly, I mean, it's, as you said, it's almost 100% effective against critical illness. And that is one thing we want to prevent. As a hospitalist, what I hope to prevent is people being on a ventilator or being critically ill to be in the hospital. So, I mean, you can talk to people who've reviewed the information, but if you want to personally review it yourself, go to the CDC website. And I think that, you know, both companies that also are producing the vaccines have the information themselves.
Yeah, I agree with my colleagues. I think the CDC, the Center for Disease Control and Prevention, has all of the data. I believe the Wisconsin Department of Health and Human Services has that data available for Wisconsin as well. In terms of, you know, what happened in the trials, the CDC is also continuing to monitor how the vaccine is doing in those who have been vaccinated. So once people are vaccinated, they have the option to sign up for a program to the CDC where they can report whatever you know, side effects that they believe that they have from the vaccine. So that is continuing to be monitored, and you can look at that information and weigh it, you know, the very small, if any, reported side effects from having the vaccine versus the consequence should you become infected with COVID-19.
Thank you so very much once again to our purposeful panel. And I know that especially our children, young people are learning so much. This is about science. This is about us trusting the science. And at the end of the day, it's about us living. It's about us living as a people. I've been to funerals of family members on Zoom, in person. And if I could bring them back and give them the vaccine, I would. I'm telling you, it's about us living. So once again, I must emphasize, stop listening to the wannabe doctors on social media and Instagram with all of their opinions, you know, and all of these conspiracy theories. You have 3 classified, certified individuals today who are giving you factual information. This is what they do. They've done their research, they've studied. So you have Black brilliance at the highest level, Black brilliance at the highest level here today. I want to thank you, amazing audience members who are asking questions. I didn't get the first individual's name, but she was amazing. And then also Rising Reggie, who had the mic in his hand. Man, when you got on the mic, it was powerful, Doc. So thank you for your question. We're going to go back to Leading Laura, who has another amazing audience member who's going to ask a question. And our purposeful panel is here, and they are ready, and they are definitely doing a GOODJOB. Good job, good job. Leading Laura, bring that individual up on this Resurrection Sunday.
You went back on mute.
Ask the patients to take the shot. And what's the difference between the Pfizer and the Johnson & Johnson? And is it safe?
So what's the difference between the 3 shots? And then as a breast cancer survivor, what are the maybe advice that you would give to someone like her?
Is it safe to take the
Is it
shot?
safe to take a shot? Or is your advice?
Should I take it?
Should she take it?
I want to know.
Okay.
Did I hear the question right? Is she asking if the differences between the vaccines and if they are safe? Okay. So, I mean, currently, I'll take the lead on this. We have 3 authorized vaccines: the Moderna vaccine, the Pfizer, and the Johnson & Johnson. The Moderna vaccine and the Pfizer are basically similar. It's called the mRNA vaccine. And the Johnson & Johnson one is a different one. I think that irrespectively of which vaccine you get, they are all highly effective. And that's kind of the bottom line. They have a very good safety profile from what we've read so far. I mean, as of now, millions of Americans have been vaccinated. And although, I mean, people might have some mild side effects, which is to be expected, the risk of having a severe reaction has been very, very low. So I will say that it's very, very safe to get the vaccine.
So I echo Dr. Amankwah's statement that the vaccines are pretty similar. Honestly, the decision to get the vaccine, I recommend get vaccinated if you can. If you have any, as far as medical questions, definitely speak with your provider, your doctor, for personal directed medical advice. What we can give is that in regards to people with other medical conditions, my patients with various immune disease and different things like that have gotten vaccinated, and majority of all that I'm aware of have tolerated maybe minimal side effects like fever, body aches, and those type of things. So if you can get the vaccine, I'll say get whichever vaccine you can get, whichever one is available for you. I received the Pfizer, my wife received Moderna. I know people who received Johnson & Johnson. So whatever vaccine you can get is what I'll recommend for you.
And sorry, one major difference I forgot was that the Johnson & Johnson is only one shot, and the Moderna and Pfizer, you need 2 doses. So, for convenience, some people might opt to take Johnson & Johnson. But I think, as Brian said, get whatever is available to you.
From a logistics standpoint, the way that vaccines are being distributed to different centers is that they're trying to keep it so that, each vaccinating place gets one type of the vaccine to keep things similar. So if you get the Moderna, it's 2 doses and they're given 28 days apart. So you go on the first day, get your first vaccine, you're asked to return on day 28 or sometime shortly after that to get your second vaccine. It's important that you go to the same place where you got your first vaccine. Pfizer is given 21 days apart. So you go day 1 and you're asked to come back on day 21 or around there to get your second vaccine. And then the Johnson & Johnson, you only have to go once. So I think that it's the message is you get the vaccine that's available to you the soonest. So if you have to wait a couple of weeks to get the Johnson & Johnson, but you can get Moderna or Pfizer tomorrow, go get Moderna or Pfizer, because we don't know what's going to happen in those couple of weeks. And so you just need to go where you can get a vaccine the soonest. And if you do get a Moderna or Pfizer, it's really important that you return to the same place to get the second one.
Thank you so very much for those insightful answers once again. And thank you, ma'am, for asking that question. One of the things I can definitely let you know is one of the side effects of not getting the vaccine is potential death. Okay, that's one of the side effects of not getting the vaccine. And so getting the vaccine, okay, beats any side effect, okay, that not getting the vaccine will bring about, and that is potential death. And so we definitely, whether it's Moderna, Pfizer, Johnson & Johnson, I've had family members who had all 3, my entire family. We've had the Pfizer. I had to wait those 3 weeks, but it was worth it. It was worth it. And so African Heritage Inc. wants you to understand it's about that life-saving information, vaccination, education. I cannot reiterate enough. Don't listen to the conspiracy theories out there. Don't listen to the conspiracy theories out there. We deserve to benefit from the vaccine. We deserve to live as a people. We deserve this. Our community deserves this. Our legacy deserves this. So listen to our experts on the panel today. And leading Laura has another question from this amazing audience. Listen, you children, y'all, listen, this is amazing. These children and young people and these families, you are so amazing out there. When it comes to that vaccine, I want you to say, I can, I will, I must, and I got this. I can, I will, I must, and I got this. That's what I'm saying. And before we get to the next question, very important. Although I have my vaccine, I still wear my mask every day in public. So when you get the vaccine, that doesn't mean you stop wearing a mask. No, I stay prayed up. I stay masked up every day. every day, even though I'm already vaccinated, I stay masked up every single day. So when you get the vaccine, not if you get it, when you get it, still wear your mask because COVID-19 is still out there. Leading Laura, let's go to our amazing audience for that next question.
Hello, everyone. My name is Kishelle Anderson, and this is a two-part question. Let me know if I'm doing too much. It is. But my first question is it true or false that they have vaccinations for youth? Are they testing the vaccination on youth?
Okay.
I couldn't hear.
So Laura, if you would, please, leading Laura, if you would, please repeat that excellent question. And ma'am, thank you for your enthusiasm. I love your enthusiasm on this Resurrection Sunday. I love your energy and your enthusiasm. Leading Laura, for our purposeful panel, would you please repeat that question?
Safe for youth to take the vaccination. So who's eligible right now for the vaccination?
So can you hear us? All right, so I think you're asking, is it safe for you as a person to take the vaccine? If you're eligible, if you're over 16, yes. I've taken.
Youth, like Y-O-U-T-H.
Kids.
Youth, children.
Oh, youth. Oh, sorry.
Or young adults.
Sorry.
Okay, we're going to
Children.
you.
I
Hold
apologize.
on 1 second, Dr. Temple. Hold on 1 second.
So you say for children to take the vaccine. So at the moment, it has not been approved yet. There are some individuals who receive the vaccine who are very high risk, and then that is usual decision with their physician, their providers. But there are studies that are going on right now. The recommendation is everyone over the age of 18, I think 16 in some places, but really anyone younger than that, then that's the studies. They're not expecting any problems, but the studies are ongoing.
The Pfizer was approved for anybody 16 and above. And then the Moderna and Johnson & Johnson is for 18 and above. Yes, there's currently an ongoing study for people between 12 and 18, but we have to wait and see what the trials show.
So thank you so much for clearing that up for me. My part two for my question is, how safe do you think Johnson & Johnson vaccinations are for our Black community? Because I believe that that's something so familiar for us growing up on the lotions and the powders, baby wash. So I'm just looking for a broader aspect of the Johnson & Johnson vaccination for our Black community.
I can start on that. I thank you for asking that question, because I think that gets to a lot of the core issues around the vaccination, is that there's, for many rightful reasons, our communities, we have very good reason to not trust government, to not trust corporations, because of things that have happened in the past. And that, while that is true, in this scenario, we cannot let that history keep us from having a future. So with the testing of the Johnson & Johnson has undergone the same procedures for testing as all of the other companies have, in terms of, the data that they've had to show, the people that they have had to enroll in their studies, and the oversight that has been happening. I think one of the things that makes this process different than other scientific process in the past is transparency. So there's been a lot of people looking at the data, because we cannot afford to get this wrong. So there have been a lot of people who have looked at all of the data before these vaccinations were approved. People from different identities have been involved in the development of these vaccines, in overseeing the rules and regulations of who will be vaccinated. And in terms of how, this rolled out, in terms of, it was first, the people that were first eligible or first encouraged to take the vaccine were our frontline workers, right? So we put our healthcare workers first. I think that I as a scientist, I as a Black woman would have been concerned if the message had been like, hey, why don't we start vaccination programs in our Black community? Then I would have been like, hold up, we need to have a conversation. But the way that this is rolled out, our colleagues that have brothers and sisters that have been involved in making these decisions, and I have faith in this process. I may not have faith in the people running a lot of the processes, but I have faith in these processes that we have been given data that supports that these vaccines are safe for Black communities.
And I can also add that in both the Moderna and Pfizer trials, I haven't really verified for Johnson & Johnson that they had about 10 to 15% of the demographics in the trials being Blacks. So, you can verify the data for yourself, but I think that people from our community were well represented in the trials. And that would hopefully give us some information as to how safe this vaccine will be for our community.
Thank you so very much. Thank you so very much. And once again, your enthusiasm, the individual asked that question, you are so enthused. I want you to be one of those, I can say, disciples in that area of Northeast Wisconsin. I want you to spread the word. I need you to spread the word. I need you to hold up signs. Okay, I need you to do whatever you have to do. I need you to go to those PTA board meetings. I need you to do that. Whatever it is virtually, I need you to do that. I understand you have another question. I'm going to allow you to ask that question. Let me say this as well. Well, before I do that, because you are on a roll right now, you are on a roll and you are powerful. And I'm going to challenge you, woman of excellence. I'm going to challenge you to start using your social media platform to advocate for this vaccine. That's one of the things we can all do. Young people, you're out there in high school, young adults, you're in college, family members. A lot of times we use our social media, you understand, in ways that don't help us grow. So I'm going to say this. Let's turn our social media into business media. Let's turn our social media into business media. And I'm about the business of saving Black lives, because not only do Black lives matter, Black lives are matter. Black lives don't just matter, Black lives are matter. And one of the matters that we have is called the arm, the flesh. The arm, that's where that vaccine has to go, in your left arm or your right arm. Once again, life-saving information, vaccination, education. African Heritage Inc. is all about that. We All Rise is all about that. Leading Laura, go ahead and let that individual, that awesome community activist who's going to do great work, go ahead and let her ask that third question at this time.
Yeah. Thank you so much for that empowering message. So this turned into a three-part question. So excuse me for the time being, but also as a Black community, and sometimes I can only speak for myself, but just hearing COVID, anything is a little bit fragile for us in our community. So in front of everyone, I would like to hear what vaccination that you all have had yet.
Leading Laura, if you would, please repeat the question. Please repeat her excellent question, and so that the purposeful panel can answer accordingly. Please repeat her question. She made some awesome commentary during the question, and I applaud her for that and give her a GOODJOB. Good job. So leading Laura, if you would, just repeat her question only for our purposeful panel. Thank you so much.
The question was, can you all hear me? Okay. The question was, which vaccine did you all get and which one would you recommend?
Did it say which vaccine we all got? I got a Pfizer, but that was what was available from my institution.
I, again, received Pfizer, but like I said, those were the first vaccines that were released. At that time, again, we were the first few getting those vaccines. So if you want to say they were trying it out on us, yeah, we got those vaccines. Which one would I recommend? All of the above. Whichever one you can get is the one that's best for you.
And I received the Moderna. And I agree. I think that the one you get is the one that is available to you the soonest.
If I may interject, I actually work in De Pere at St. Norbert College, but I live in Appleton, and I have been working from home since last year. In other words, I've actually been teaching from home since last year, and I couldn't wait to get mine. And I can finally and proudly say I got the 2 shots of Pfizer. I got it for my 85-year-old mother who lives with me. I got it to keep my husband safe. I also got it to keep my daughter safe because I have been home since last year and I can't wait to get out, if nothing else, so African Heritage Inc. can do Juneteenth. So please get the shot.
Yeah. And I took the Moderna, and I get my second shot this coming up Wednesday, and I'm very excited about it. Not only to help my family, but save my own life because I have some comorbidities and I want to live. And so for myself, my people, and the world that I interact with.
Thank you all. Thank you so very much, Dr. Dutiful Delano, Dr. Respected Robbins. Thank you for our purposeful panel. And listen, young people, at the end of the day, listen, families, we walk it like we talk it. Walk it like we talk it. Hey, walk it like we talk it. You understand? Listen, there's a song out there the young people like, the young people you like, Darrell out there, and Darrell talks about we going where the money reside, where the money reside, where the money reside, where the money reside. Well, we going where the vaccine resides, where the vaccine resides, where the vaccine resides, where the vaccine resides. Because it's about that life-saving information, vaccination, and educating. You know, education. Listen, as a man of faith, as we begin to wind down, as a man of faith, I've talked to a lot of individuals who are believers like myself. And, you know, they've told me that they're not getting the vaccine. You know, they say, look, I have faith in God, Keith. I'm not getting this vaccine. And at the end of the day, I have faith in God, too. But faith without works is dead. Let me just put it out there. Faith without works is dead. So for those of you who are faith-based and believers like myself, faith without works is dead. We have free will. We have free will to help save our lives. So with all the faith I have, I'm not about to jump off of a 32 floor building, okay, and just believe that I'm going to land and I'm going to live because of my faith. No, I have to make wise decisions. And one of the wisest decisions we can make in the Black community, as Dr. Keller said, okay, listen, if they were just promoting this in the Black community, then we would all have red flags up. But anytime something like this is being promoted on a universal level for all people, Black people, we cannot miss the boat. We cannot miss this opportunity. We cannot miss this opportunity. I have one more question that's very important. What about those individuals, to our panel, what about those individuals who say, look, I live a healthy lifestyle. I've never taken a flu shot. Okay, why should I take COVID-19? All right, I live a healthy lifestyle. So to the panel, for those individuals who say that, will their healthy lifestyle protect them from the virus? Will their healthy lifestyle protect them from the virus?
So you live a healthy lifestyle. Honestly, I applaud you because we all need to do that. You need to exercise, which you need to continue. Even if you get vaccinated, we need to exercise. By exercising and doing these things, we decrease the other comorbidities that increase our likelihood and our risk for death. All right. The one thing we've seen that unlike flu, we've had such a high mortality rate. You might live a healthy lifestyle, but yet you can still be an asymptomatic carrier of the virus. Therefore, giving it to your grandmother who has 3 or 4 different comorbidities, or your mother or father, and they can die. So you might not die, but it would hurt if someone that you know that's related to you, or you don't know, or your neighbor dies because you expose them to a virus. That's preventable at this point.
I absolutely agree with that. I think my response is someone who, if their rationale and their argument that they live a healthy lifestyle, my response back would be, what if you're wrong, right? So are we willing to gamble with our life when we know that there is a vaccine that is available, that is safe, that can prevent us from ending up in the hospital, attached to a machine that's breathing for us, or even worse, we end up dying, or we pass it on to our loved ones who end up dying. I'm not a gambler, so that's not a risk that I'm willing to take. And I think that the question we have to ask ourselves is, what if we're wrong? If there's something that we can do to potentially prevent that outcome, shouldn't we do it?
I totally couldn't agree more. And also to add that, the variant strain is unfortunately affecting younger and healthy individuals. So no matter how healthy you are as an individual, I think that the risk of having COVID-19 is so high that I would strongly recommend that, not just for yourself, even for your community, that you should get vaccinated. That will be the only way that we'll get a herd immunity to really get back to normalcy.
Thank you very much. Thank you very much to our purposeful panel. Listen, to our panel, I just want to say GOODJOB. Good job. Good job, everybody. GOODJOB. Good job. Good job. Come on. GOODJOB. Good job. Good job. Put your hands together for the best panel on the planet. Listen, y'all better get these names. They are amazing. Definitely. In the coming weeks, we're going to be doing more and more campaigns on our social media. I will be having it out there on Instagram at Keith L. Brown _ KEITH L. Brown _. We got African Heritage Inc., AHI Appleton. Definitely follow African Heritage Inc. on Facebook to get all of the life-saving information, vaccination, education. I want to thank We All Rise, Greater Green Bay Community Foundation, our sponsors. Okay, listen, DJ Hayes did a great job. I'm going to bring back African Heritage Inc. in just a moment, but I want to thank those of you who showed up. And remember, before you leave, you better get those Easter baskets. I'm like old school. I remember saying my Easter speech back in the day. I couldn't wait to get my Easter basket. So y'all get those Easter baskets and definitely get signed up for the vaccine. You learned so much today. And now you cannot say you don't know, because you know, but I want you to encourage others. Make it like a family reunion. We just did a virtual family reunion. All right. And guess what, y'all? All we talked about was the vaccine. And so listen, you all have to spread the word in your communities, on your social media pages. This is what today was all about. Life-saving information, vaccination, education. Thank you all. Don't go anywhere just yet, because guess what? I'm bringing back Dr. Dutiful Delano, Dr. Respected Robbins, and Leading Laura Jones is coming back. They're all coming back. I'm African Heritage Inc. Y'all see it behind me. Get the shot. Get the shot. Hey, get the shot. Get the shot. Hey, put your hands up. Now, everybody say, get the shot.
Get the shot.
Say, get the shot. Hey, say, get the shot. Hey, say, get the shot. Hey, left arm, right arm, it don't matter. Get that shot and your body will be gladder. And that's all right, y'all. It's time to give. Why get the shot? Because it's time to live. Life-saving information, vaccination, education. Keith L. Brown, Mr. Impossible, turning it back over to African Heritage, Inc.
Thank you, thank you, thank you. Thank you, my brother, Keith L. Brown, Mr. Impossible out of Atlanta, Georgia. Thank you, thank you, thank you. Thank you to this family, my family of medical experts. Thank you, thank you, thank you. My brother, Dr. Richard, thank you so much. My sister, Dr. Abiola, thank you. And my brother, Dr. Ryan, thank you, thank you, thank you. African Heritage wants to thank We All Rise for giving us this opportunity today to spend Easter Day with them. Thank you, We All Rise. Thank you to our sister, Robin Tinnen at We All Rise. Thank you to the staff at We All Rise. Thank you so much. And then we wouldn't have been able to do this event in Green Bay without the support of Greater Green Bay Community Foundation. So thank you to Greater Green Bay Community Foundation. It is the first, but it's not going to be the last. It's going to be the last when all of us get the shot and we can basically crush COVID-19. It's not going to crush our communities. We are going to crush COVID-19. Other communities out there, we will be coming to you. Oshkosh, watch out, we will be coming to you soon. Thanks to Oshkosh Community Foundation for supporting our campaign. We also want to thank Community Foundation for the Fox Valley region for also supporting Get the Shot, Leave campaign. We also want to thank some of our volunteers and supporters. DJ Hayes and One Structure, thank you for the music. Thank you. These brothers have stepped up to support DJ services for any of our events. So I want to say thank you to them. I also want to say thank you to our sister Tasha Banks, who's doing the food for us. And for those of you who may not know, our family right there, they had an Easter meal. They had chicken, they had ribs, they had mac and cheese, they had collard greens. I could go on and on, but that's what they're doing right now at We All Rise. So thank you, Sister Tasha Banks and the Jug Joint. Thank you so much. In addition to that, we also have other supporters. We also have the Sigma Upsilon Lambda chapter of Alpha, Phi Alpha, and that is Dr. Temple's fraternity. So I got to make sure I do a shout out because some of our brothers were actually out there today in person. So thank you, my brothers, for being out there today in person to also support us and volunteer. Shout out to you all. But we also want to thank some additional hospitals. Without them, our two medical doctors wouldn't be here today. Aurora and Prevea. Shout outs to you all. Thank you for supporting our doctors and being here today. I will ask Dr. Robbins to continue with any other thank yous that I may have forgotten about.
Yes, thank you, Dr. Delano. We have African Heritage has garnered the support of many community stakeholders. Dr. Delano mentioned some. I want to also thank One Structure. I also like to thank Theta Care Health Systems and also our production team that you didn't see. So Victoria Allen, and then also thank Inya Roach. I saw her out there. And then also our community and our outreach, social outreach director, Laura Jones, that was on site with you all. And so I just cannot say how much we are appreciative of you, but here's the call to action. The call to action is straight up, get the shot. 2, encourage other people to get the shot. 3, volunteer for the campaign. Let Robin Tinnen know what you can do. We need people in Green Bay spreading the word. So stay connected, and so that we can live, get together again, and then keep on for our fights for freedoms for ourselves and for our people and for our children. So you heard the 3 points of action, and we will be following up. We want to call Robin back at We All Rise, and she has a whole list of people that want to join this campaign, get the word out. So happy Resurrection Sunday, happy Easter. Enjoy the baskets, and then you join the campaign, you get the shot, you get the swag, t-shirts.
That's right. And you get lots of swag materials. And guess what? We have so many items out there. Gift cards, swag materials. You need transportation. We got it too. So we got a whole lot, okay? We got your back, but we need you all to get the shot. If you look on your tables, there are opportunities there. You can actually register and we will help facilitate where you're going to get your shot. Be it Appleton, be it Green Bay, be it Oshkosh, we will support you in getting the shot to the point that when you get there, they're going to give you the VIP treatment. But all we need you to do is please get the shot and let's save our lives as Black people. Thank you so much.
Yeah, I just want to say, and if you're afraid to get the shot, we have someone there that can hold your hand to give you emotional support. You have no excuse. We are taking all the barriers away. You need food, we'll get the groceries. You need transportation, we'll get you there. You need a friend, we'll be your friend at that shot. Okay, so we will do that. So thank you so much.
Yes, thank you all so much. African Heritage Inc. loves you. Get out there to those Milwaukee Bucks games in front of the arena. The baseball is coming back. Get in front of that stadium. Okay, even when the Packers come back, listen, whatever it takes, you all get out there and y'all advocate. Green Bay advocate, excelling in you. Thank you so very much. Victoria's Victoria. Leading Laura is coming back to close us out. I believe she had an announcement. GOODJOB. Good job. Good job. Spread the word. This is the launch, and we decided to launch.